Dr. Lawrence Lau from the University of Hong Kong. So University of Hong Kong is one of the university in the Asia, and I'm working in its Department of Orthopedics and Traumatology. And this is the hospital that I'm working in. It is called the Queen Mary Hospital. So I am a joint replacement surgeon by daytime, which I replace knee and the hips in the Queen Mary Hospital and the Duchess of Kent Hospital, Children's Hospital, which is actually a joint replacement center. So I mostly conduct my research after my clinical duties when I finish seeing patients and doing operations, and then I do my research at night time. So it is quite busy, but the advantage is that my research are mostly directly related to my patients. So let's go through some of my research. So currently I have several research focus. Some of them are on clinical, translational, and basics. So for clinical, I mostly focus on optimizing the arthroplasty management pathway, and also for the management of osteoarthritis and the interrelationship with some metabolic disease like obesity and sarcopenia. So this is one of my recent publications. Actually, this is one of my recent higher cited article on weight loss intervention before arthroplasty. Because actually we notice obesity is a very common scenario amongst disease. Obesity is a very common disease among joint replacement patients. So it adversely affects all the outcomes of totally replacement. So we found that performing weight loss intervention is potentially benefits to the patients, and it is also fulfill our idea of having a holistic care for all our patients. So because of that, we are currently running some clinical trials to perform weight loss intervention to benefit clinical outcome, and hopefully we have obtained a government grant, and hopefully we can share with you all some of the data in subsequent scenario or situations. So actually, another study that I performed, this is another I call FRCS study. Ben is my medical student. We also review the situation of obesity among various Asian countries by looking through the Asian Joint Registry data. Then we found that actually, obesity is also a very common scenario amongst joint replacement patients in the whole Asia. Many of them would quote a BMI around 30. So, because Hong Kong is a multiracial society, as shown in this our government data, we are also currently securing some fundings to perform wage control for different races in Hong Kong. So to improve the situation of obesity and arthritis, and hopefully we can achieve a greater social benefits for our hometown and also for the Asia. So other than obesity, I'm also interested in sarcopenia. These two reviews are not written by me, but they summarize the recent findings that sarcopenia adverse affects the joint replacement outcome. But based on the review of this article, I've reviewed that this is one of my PhD performed study, which I call first and led study. Actually, from the systematic review, we found that this article from our group is actually the first Asian study investigating the impacts of sarcopenia on knee replacement, which we found that sarcopenia will adverse the knee replacement patient outcome, and it is actually very common among the knee replacement patients. So we are also again securing some fundings to hopefully work on this aspect, and some clinical trials on the way. So besides clinical study, I also perform some translational study. So this is one of the long-term clinical study. But what I want to highlight is that some of our patients are having very difficult replacement. For example, this one of our patients are having a pelvic discontinuity as shown in here. So here we use a ORF and also with a large jumbo cup. But this is just one of the solution. Another solution would be using a cup, which is actually a custom tri-flange is a patient-specific implant, which we use 3D printing to pin a specific defect, to pin a implant that specifically fits the defect of the acetabulum. For example, this is one of our recent patients which suffer from a very large pelvic defect with under pelvic discontinuity, and we replace it with a custom tri-flange. So obviously, the results of the custom tri-flange will very much depends on the quality of 3D printing. So this is one of our good, very recent publication, which we summarize the current technology and latest technology on 3D printing. And we hope we shall build on that foundation to make more advancement in this transitional aspect of orthopedic research. So this is another topic that I'm previously working on. So because I'm joint replacement surgeon, and polythene wear is one of our common encountered scenario. It will cause a lot of problems like implant damage, metallosis, instability, but it is not able to pick up in most of the scenario because it will have lots of the artifacts from the implants, and it is not shown on the X-ray. So certain time ago, I come across this technology known as the spectral photon counting. So it was originally invented to detect the large hadron, detect the particle collision in the large hadron colliders, and it measures how specific X-ray wavelength will change to determine the material compositions. So based on that interesting technology, I come up with the idea of whether it can detect the polythene wear, which turned out to be possible, as shown in this paper, which I first offered. Using this multi-energy photon counting computed tomography, we were able to clearly show the defect on the polythene, which are not able to be seen in a conventional CT or MRI or X-ray. And again, some other of arthroplasty complications commonly encountered by us. So, for example, arthroplasty loosening, as shown in this picture. So, in cases with arthroplasty loosening, there's some radiological signs. So, what I did in my previous research is that we use artificial intelligence to detect these radiological signs of loosening. And it was actually published some times ago when ChatGPT or others artificial intelligence was not yet available and not as common as nowadays. So it was one of the earliest article on using AI in orthopedic fields. And interestingly, actually you can see the artificial intelligence were able to gradually localize the sites of loosening with time progress, showing that actually what the intelligence is seeing is matching the surgeon's observation on the implant. So I also performed some basic science study. For example, this is actually one of my patients, which developed subsequent joint pain and arthritis during the period of COVID, which we found there were some signs of similar to what we call SONG, a spontaneous osteolysis of the knee, which we subsequently performed the unicompartment knee replacement. So we found actually campaign of joint pain arthritis is quite common amongst after the COVID period or during the COVID period, and we perform further investigation on this this phenomenon. So what we find with collaboration with some colleagues, we were able to find that actually the SARS-CoV will activate a pathway called endothelin, which will cause subsequent the viral protein and leak into the subchondral bone. We were able to demonstrate that there were osteoclast activation and the reducing chondrocytes and formation of cystic change over the bone. And we were able to identify some potential medication to counteract that as well. So another study that I'm recently working on is using proteomics to detect the some endotype of the OA. So because synovial information will is one of the contributing factor to the OA progressions, and there were actually different endotype or phenotypes of the OA, and there were very complex cell-cell interactions and protein metabolic interactions. So how to make use of the data or clearly differentiate different subtypes are very difficult. So in that study, we based on a method. Actually, we invented a method that integrate a proteomics and metabolomics and the histology, and we were able to perform a molecular endotyping of the osteoarthritis. And this also matched my clinical interest, which on the obesity phenotype of OA. So in this study, we were able to perform using a spatial proteomic and metabolomics image datasets, and we identified 4 distinct functional stages of OA, including the quiescent microvasculopathic, pre-fibrotic, and post-fibrotic stage. So in this study, we were also able to highlight that there was dysregulation in the lipid metabolism as the amplifier of this transition between microvasculopathy to fibrosis transition, which allow us to confirm that OA is partly related to the metabolic dysfunction of the patients. So this concludes some of my recent research that I'm working on. I think one of the biggest challenge is securing of funding. I think this is actually a global difficulty, particularly actually in US as well. Although I'm not working in US, but I know the NIH cutting the funding is causing a lot of difficulties among researchers. Some of my friends actually they receive NIH funding, and they also reflects that they have lots of difficulties in these difficult periods. And even for me, although I mostly obtain funding from Hong Kong, so I think securing funding in this, I guess, a global financial difficult situation that is we have encountered lots of difficulties. So also securing some good manpowers, someone that can, for example, perform the spatial proteomics, and also someone that can help the clinical trial. All these are quite difficult in some financial difficult situation. Again, I think patient support is very important, and patient understanding, because I think in Hong Kong, mostly our patients are quite supportive of our research, and they know that what we are trying to do is ultimately want to benefit them. For example, curing, I mean, not curing, but improving the obesity. Overall, we want to improve their arthroplasty outcome, but we also want to improve their whole person, not only the knee or the hip outcome, but also, for example, the overall cardiovascular risk profile, or whether there are subsequent risks of mortality, stroke, or heart attack. I think orthopedics, my research focus, from my research focus, you see, I'm mainly a joint replacement surgeon, and osteoarthritis researcher. So actually, some would consider that osteoarthritis and those metabolic diseases are very heavily linked. When they cannot walk, they cannot lose weight, so they cannot perform all the exercise, and they will subsequently dramatically increase their metabolic risk. And this was actually there are some systematic review and meta-analysis that document with osteoarthritis, the overall mortality of the patients will increase compared with those without osteoarthritis. So basically, what I'm doing on this aspect is trying to improve the whole patient overall health, not only limited to the joint, but their overall health.